for the YouTube to pop up, and then I'll get started.
Okay.
Okay, Dr. Pugh, let's see. I'm waiting for the. Right. Welcome, everyone. We would like to welcome you all to our um our community engagement project around asthma, basically looking at what is going on in Lorain County. Dr. Pugh, if you can take your participant sheet down um from the main screen.
I don't know why it's doing that. It shouldn't be doing that.
Thank you. So one of the things that has been going on, so I'm Ivanka Hall. I'm the executive director of the nationally recognized Northeast Ohio Black Health Coalition. We are the first coalition in the state of Ohio to focus exclusively on African American disparities. Our work is to create equity by addressing the cumulative impact of racial, economic, environmental, and social justice inequities within the African American community. And so we have been contracted with the Ohio Department of Health, their Asthma Minority Community Engagement Project, to talk about asthma and the impact on our communities. Three communities in particular in Northeast Ohio are our focus. So Lorain County, Mahoning County, and Cuyahoga County. Why Lorain County? So one of the things that we do know is that African Americans in Lorain County have experienced asthma death rates higher than their white counterparts between 2016 and 2021. And that Black adults and Black children County experience significantly higher rates of asthma hospitalization rates, emergency room visits, and death. And so it is important for us to know that focusing on the hospitalization rates and the deaths from people who have suffered from asthma attacks. So we know that within this area, it is important for us to talk about the fact that female adults and male children in Lorain County typically experience higher rates of asthma, hospitalization, and emergency department visits compared to their respective gender counterparts. Um, and for Lorain County in particular, Hispanic adults and children in Lorain County experience significantly higher rates of asthma-related emergency visits. And our continued efforts have been made to tackle the asthma burden in Lorain County. And so when we talk about what's going on in our communities, we definitely have to look at the fact that we don't have a tree canopy in these areas that we're looking at. Some of the other historical factors around some of the legacy pollutions that are there in those counties. And the other burdens of disease on communities of concern. And so for purpose of tonight, we're going to be talking about our communities of concern. I'm going to have Dr. Pugh introduce herself, and then we're going to, I'll talk a little bit more about this exhale piece, and then we're going to go into a video. Dr. Pugh.
So I am Dr. Lachelle Pugh. I am the Assistant Executive Director of the Northeast Ohio Black Health Coalition. And excuse me, we're glad that you're all here today. We hope that you find this event to be informational and informative and hope that you all take away something that can help you or your loved ones. Thank you.
And so when we talk about what happens when we talk about the prevalence of asthma in Ohio, particularly for our adults, 1 in 10 adults in Ohio presently has asthma, and 1 in 12 children. About 14.5% of adults have been told at some point in their life that they have asthma. So this is the thing around asthma. A lot of times what happens is we're diagnosed with asthma when we're younger, and people think that they have outgrown asthma, but you don't outgrow asthma. And so asthma is always there. It is possible that you may not have a trigger for a very long period of time, but asthma doesn't go away. And so when we're looking at some of the things that are going on currently, particularly this COVID flirt version of COVID, one of the things that we've been seeing is a number of hospitalization rates from communities who are having some other issues around breathing. One, because of the extreme heat that we're having. The other is because of the air quality issues that we're having in our cities. And so we've been having these air quality alerts probably for about the last month. And so making sure that you're monitoring those, particularly when you're looking at doing outside activities. I know that some of you, I see that Paris is on here from the Urban League, and I know that they work with young people. So particularly when you're working with young people and working with camps, that you understand around the fact that some of the air quality issues may cause some of the children to have some asthma or breathing issues. Over 25% of adults have missed at least one day at work due to asthma. Over 20% of children have missed at least one day of school due to asthma. And nearly 48% of adults limit their activity due to asthma. So a lot of people limit their activities because they don't want to have an asthma attack. We actually have a young woman who works with us. We've been doing some straightening out of one of the areas in the office, and she had experienced 2 asthma attacks directly tied to the dust. So it's important that if you're doing any type of cleaning or any type of things like that, that you have your inhaler with you, for one, if that is your work that you're doing. But for the other, have on a mask. Make sure that you're wearing your mask. That's important. About 33% of children limit their activity also due to asthma. And so when we look at this obesity rate in relation to our asthma rates, we know that 1 in 2 adults currently have asthma are obese, and 1 in 4 adults that currently have asthma are normal weight. So that's versus the 1 in 4 adults that currently have asthma that are at a normal rate. And when we look at asthma also, because of some of the limitations that people place on themselves, we may also see some people who are experiencing some depression. So adults who currently have asthma are over 2 times more likely to be diagnosed with a depressive disorder compared to adults who do not currently have asthma. When we look at our hospitalization rates are higher in women than in men. And so that was one of the things that came up yesterday around the number of the fact that women are more likely to be hospitalized than men. And then looking at other people who have other types of health illnesses, like they may have COPD or they may have emphysema or bronchitis. So looking at all of those things and how they impact the lungs. I recently lost a family member who not only had asthma, but also had chronic emphysema. And so because she had chronic emphysema, she had been experiencing some health challenges for quite a while. And she succumbed to her health challenges a couple of weeks ago. And so for sake of this, it's important that tonight that you take away our piece around exhale. And so exhale is what we're going to do tonight. Educational asthma self-management, extinguishing smoking and secondhand smoke, but not just looking at secondhand smoke, but also looking at thirdhand smoke. So thirdhand smoke is a smoke that is in the residue of your teddy bears, on your couch, on your clothes. That is thirdhand smoke. So looking at the things that are still there in the room when people are smoking and you leave. So you leave the things there with you. home visits for trigger reduction and self-management education, the achievement of guidelines-based medical management. So making sure that you're talking to your doctor. If you are having any types of health challenges or breathing issues, making sure that you're talking to your doctor. Linkages and coordination of care across settings, making sure that all of your medical professionals that are looking at you understand what's going on with you um, from all facets, so that you're not just going to one doctor, but all of the doctors kind of understand are able to help you along your health journey. And environmental policies and best practices to reduce asthma triggers, both indoors, outdoors, and in the occupational settings. So some people are exposed within their work settings because of the type of work they do. I talked about that earlier, particularly if you have people who are working in housekeeping or working in kitchens or working places where they're exposed to extreme heat or extreme cold. And so understanding those findings. So Dr. Pugh is going to show us a video. It is from the Asthma and Allergy Foundation of America. We have been working with them on this particular project, as well as the Ohio Department of Health, their Asthma Minority Community Engagement Project, but the asthma program in particular has been working with us. So Dr. Pugh, you got to open up the whole screen.
Okay. Hi, everyone. Welcome. Good to be here. My name is Lynn Bosma. I am the Health Equity and Outreach Program Manager with the Asthma and Allergy Foundation of America. And my colleague here is Jessica Jackson, who's AFA's Asthma and Respiratory Health Program Manager. And we are going to talk with you a little bit today about asthma self-management. Okay, here's our quick agenda. We're going to talk briefly about some facts, some things about health disparities, some asthma basics, some tips on how to manage asthma and avoid triggers, some resources, and where to submit questions. So if you're not familiar with AFA, we are a national patient advocacy organization, was founded in 1953. We're the leading patient organization for people with asthma, allergies, and the oldest asthma and allergy patient group in the world. Our mission is dedicated, AFA is dedicated to saving lives and reducing the burden of disease for people with asthma and allergies through advocacy, education, research, and support. So I'm going to talk with you a little bit about some asthma facts. So asthma is one of the most common and costly diseases in the United States. Over 27 million people in the US have asthma. This is about equals to 1 in 12 people. It's a leading chronic disease in children. About 4.5 million children under the age of 18 live with asthma. It's more common in male than female children, and non-Hispanic Black children are nearly 2 times more likely to have asthma compared to non-Hispanic white children. Adults, some asthma facts for adults. So 22 million US adults aged 18 and older have asthma, and asthma is more common in the adult population in females, so it's flip than males, 10.8% of the versus 6.5%. And asthma rates are highest in American Indian or Alaska Native adults in the US. This is a slide discussing the burden of asthma on the Black, Hispanic, and Indigenous individuals in the U.S. Unfortunately, the burden of asthma falls heavily on these communities, and they're at the highest risk of asthma rates, hospital visits, and deaths. Black people in the U.S. are nearly 6 times more likely than white people to visit the emergency department due to asthma. So AFA knows that this can help us shape how we approach health education in all communities, and we work on policy changes to ensure equitable access to things like healthcare and other resources. Talking about health disparities, we know that health disparities result from a series of factors, many of which stem from environmental or social injustices. So racial and ethnic disparities They're complex and they vary across levels of social, structure, and genetic factors. Things like unequal distribution of stressors in people's environment. So things like living in poverty, not having access to good housing, not having access to things like quality health care, things like that can be part of those systemic injustices that I mentioned, and racism that has been deeply ingrained in the US policies and culture. Things like we referred to some of in the healthcare space, you might hear the term social determinants, and those are listed on your slide there. And it's speaking about situations that people are born in that determine health status, things like education, whether people have access to healthy neighborhood and social support. Looking at the environmental conditions that contribute to health disparities, hazardous environmental exposures are a growing concern, especially in light of climate change. So exposure to hazards can have a significant impact on health conditions like asthma. The risk of exposure to environmental health hazards depends on where you live. So some communities, such as low income or communities of color, are more likely to reside in neighborhoods that were founded on racial segregation and other environmental justice. So many economically disadvantaged communities are in close proximity to industrial and hazardous waste sites, for example. And these sites are known to release toxins and contaminants that disproportionately burden those surrounding neighborhoods living in that community. So that increases people's exposure to environmental health hazards, which enhances the risk of poor health outcomes. So talking about health equity, that was a lot of discussion about the concept of health disparities. So flipping it, health equity is really what AFA is committed as a core value to improving, and it's a mission critical priority of the organization. So health equity is a state in which everyone has a fair and just opportunity to reach their highest level of health. And we as an organization know that it requires strong, coordinated efforts in communities nationally, locally, working on policies, systems improvement, and reducing and eliminating personal biases that are causing harm to many communities. So we're going to talk a little bit about asthma basics. I'm going to hand this over to my colleague, Jessica, who will share some general information about asthma.
Great. Thanks so much, Lynn. So first I'd like to just share some information about what asthma is. So essentially, asthma is a chronic lung disease that causes inflammation and also narrowing of the airways. And this inflammation and narrowing can lead to asthma symptoms, which can be any combination of coughing, wheezing, shortness of breath, and or chest tightness or pain. So unfortunately, there's no cure for asthma, but it can be controlled with the right combination of medications and trigger control strategies. And when these medications are taken properly as prescribed, and also when triggers are controlled, most people with asthma can actually live a healthy and active life. So a lot of factors have been linked to an increased risk of developing asthma, but it's very difficult to find a single direct cause. However, it does appear that asthma is more likely if someone in your family also has asthma, especially if that person's a close relative, like a parent or a sibling. Asthma is also more likely in people who have other allergic conditions like eczema or rhinitis, which is just another name for hay fever. Additionally, urbanization, it's associated with an increased asthma prevalence, and this is likely due to multiple lifestyle factors. And events in early life can also affect the risk of asthma. So essentially, it impacts the developing lungs, and this can increase asthma. And these factors include low birth weight, prematurity, exposure to tobacco smoke, and other sources of air pollution. And it also includes viral respiratory infections. So exposure to A wide range of environmental triggers such as allergens and irritants are also thought to increase the risk of asthma. And this includes indoor and outdoor air pollution, things like house dust, molds, occupational exposure to chemicals, fumes, dust, and other triggers. And then finally, children and adults who are overweight or obese, they're also at greater risk of developing asthma. So with asthma, there are three main changes that take place in the airway. So first, asthma causes inflammation, and it also causes an overproduction of mucus inside the airways. And this in turn, it causes the airways to become overly sensitive or hypersensitive. And this hypersensitivity makes the muscles that are wrapped around the airways spasm. And this is known as bronchospasm. So the inflammation, the overproduction of mucus, and the bronchospasm causes the airways to become very narrow, and this narrowing leads to asthma symptoms. So fortunately, even though there's no cure for asthma, it can be managed with three steps. First, avoid asthma triggers, so the things that make your asthma worse. Second, take medications to prevent and control your asthma symptoms. And then third, you want to treat your asthma episodes if they occur. And we'll discuss this more throughout the presentation. So people with asthma, they have airways that are sensitive to certain things that might not bother people who don't have asthma. And these things are called triggers, and they vary from person to person. So when a person with asthma is exposed to something they're sensitive to, this causes an inflammatory response inside the lungs. And this inflammatory response, again, leads to asthma symptoms. And so examples of common triggers include allergens, and this can be things like pollen or dust or mold, animal dander. Irritants can also trigger asthma, and examples of irritants include smoke, chemicals, perfumes. Another very common trigger is respiratory illnesses, things like colds, the flu. And additionally, strong emotions, exercising, weather changes or extreme weather, and GERD, which is another name for acid reflux, can also cause asthma symptoms. And other less common triggers include foods, especially those that contain things like sulfites. So an example could be like wine, or sometimes foods like shrimp or dried fruit. Some people are also sensitive to certain types of medications, like NSAIDs. And an example of an NSAID would be something like ibuprofen. And then others can be sensitive to certain types of heart medications, like beta blockers. So in general, it's really important for people with asthma to avoid their triggers, and you can do this by adopting multi-component strategies. The one exception to this, though, is exercise, in the sense that it shouldn't necessarily be avoided. So usually providers will have people with exercise-induced asthma, or it's also called exercise-induced bronchoconstriction, pre-treat with a medicine, usually about 10 to 30 minutes prior to exercising or being physically active. So there are many medications that can treat asthma, and they're divided into three main categories. So first, there are controller medications, which your provider may have you take daily, even if you aren't necessarily having symptoms. And controllers, they address the underlying issue of asthma in the sense that they reduce the inflammation and the overproduction of mucus inside the airways. And controllers typically work very slowly over a long period of time. And then quick relief medications, these are used as needed. They don't address the underlying issue of asthma in the sense that they don't really do a whole lot for the inflammation and the overproduction of mucus inside the airways. They do, however, temporarily relax the muscles that are wrapped around the airways. And when those muscles relax, this pulls the airways open, which creates a much bigger space to breathe inside the airways. And so quick relief medications, they work very fast, but they don't last long. So typically their effects last about 1 to 4 hours, depending upon the person. And then finally, there are combination medications that aim to both control and relieve. And this is called SMART therapy. And we'll discuss that more on the next slide. So essentially, SMART therapy, it combines controller and reliever medications into one inhaler. And again, it can be used to both prevent asthma symptoms or relieve them. And two examples of these types of medications are Symbicort and Lorain. So these are both inhalers, and they have a combination, again, of controller and reliever. So despite the fact that asthma can't be cured, it can be controlled with the right asthma management plan. So it's really important to work with your healthcare provider to create an effective asthma management plan, as most of these plans will help you recognize your symptoms and your triggers, and also provide information on how to treat your symptoms and avoid your triggers. An important first step in asthma management is to recognize when you might have asthma or are having an asthma episode. And this can be done by identifying your signs and symptoms. So again, common asthma signs and symptoms include shortness of breath, coughing, wheezing, waking up at night due to asthma symptoms, and or a drop in your peak flow meter reading if you use one. And so for those of you who don't use a peak flow meter or who aren't aware of what a peak flow meter is, it's a handheld device that measures how well air moves in and out of your lungs. And during an asthma episode, your airways, because they become narrow, it can be very hard to move air in and out of your lungs. So if you blow into a peak flow meter and you get a low reading, this could be indicative of the fact that you are having an asthma episode, even if you're not necessarily feeling symptoms. And the peak flow meter can measure the narrowing in your airways hours, sometimes even days before you actually have asthma symptoms. Asthma can be a serious disease, and it is important to see your healthcare provider for initial diagnosis and treatment, and also for ongoing asthma management. So untreated and uncontrolled asthma, it increases the risk of asthma-related hospitalizations and deaths, but it also can cause scarring inside the lungs or inside the airways. And this scarring, it permanently damages lung function, which can lead to the development of other respiratory diseases like chronic obstructive pulmonary disease or COPD. So it's really important to create an asthma action plan in partnership with your healthcare provider. And this should be a written plan that has patient identification, information such as date of birth, and specific instructions on what asthma medications to take and when. And it's all based on asthma symptoms. And again, possibly peak flow readings if you do use a peak flow meter. And if you don't have an asthma action plan already, you can print one off on AFA's Asthma Action Plan website at afa.org/action plan. So if you have asthma, it is important to keep track of your triggers. And because symptoms don't always occur right after exposure to your triggers, it might take a little bit of detective work to identify exactly what makes your asthma worse. And delayed asthma episodes, so they might occur depending upon the type of trigger and essentially how sensitive a person is to that particular trigger. But once you know your triggers, it is important to adopt multi-component strategies to reduce exposure or to manage them. And we'll discuss examples of these strategies on the following slides. So first, we'll talk a little bit about outdoor trigger avoidance strategies. So first, air pollution, we'll talk about that. Essentially, air pollution or small particles and gases in the air, they can pass through your nose or your mouth and get into your lungs and into your blood. And both long-term and short-term exposure to air pollution can cause many health problems. For example, it can increase asthma attacks, it can worsen your asthma, it can also damage your heart and your blood vessels and cause cardiac diseases. Additionally, long-term exposure can lead to adverse birth outcomes like preterm birth, low birth weight, stillbirth, and it can also lead to early death. So pollen is one of the most common triggers of seasonal allergies. And as noted earlier, allergies are a big trigger for asthma in a lot of people. And there are actions you can take to reduce allergic reactions to pollen. So first, try to limit your outdoor activities when pollen counts are high. And this will cut down on the amount of pollen allergen that you inhale, and it also can help reduce your symptoms. Another strategy is to keep windows closed during pollen season or peak pollen times. And also, if you have it, try to use central air conditioning or air cleaners with a certified asthma and allergy-friendly filter and or a HEPA filtration device to reduce indoor airborne allergens. Additionally, you can wear sunglasses and also cover your hair when going outside. And this keeps pollen out of your eyes and also off of your hair. And then you want to be sure to shower daily before going to bed. So this removes the pollen from your body and it also keeps it off of your bedding. And additionally, you want to limit close contact with pets that spend a lot of time outdoors. So one strategy is just to wipe furry animals off when they come inside, or if you can, bathe them weekly. Additionally, changing and washing your clothes that you wear during outdoor activities is really important. This also washes the pollen off. And then when you dry your clothes, be sure to put them in a clothes dryer or hang them up inside. Don't dry them on an outdoor line because this will just collect more pollen. And then finally, you just want to keep an eye on pollen counts and forecasts. So mold is a type of fungus that produces spores that float through the air, and it can grow on almost anything when moisture or damp environments are present, and it can be found both indoors and outdoors. So mold it's also a common cause of allergy and asthma symptoms. And mold seeds, which are also called spores, they essentially travel through the air. And when you upset a mold source, this can send the spores into the air. And this makes it easier for you to breathe them into your lungs, which can then trigger allergy and asthma episodes. But you can reduce your asthma and allergy symptoms by avoiding contact with mold spores. And some steps that can help include limiting your outdoor activities when mold counts are high. Also, remove leaves and piles of dead plant material or tree clippings as soon as possible. This is because mold tends to grow in dead plant material and tree clippings. Additionally, you might want to wear an N95 mask, hat, and sunglasses when you're caring for your lawn or garden. And if you can, try to have somebody without a mold allergy do your yard work if possible. And then finally, promoting groundwater drainage away from your house is important as well. Exposure to air particles in the smoke that's released during a fire can also irritate your lungs, and this can worsen your asthma symptoms. But again, there are steps you can take to help keep yourself safe. First, you want to track the air quality index in your area, and you can get current readings on airnow.gov. You can get it on weather sites and also on smartphone apps and from local news reports as well. Additionally, you want to try to keep your asthma under control as much as possible. So you may need to ask your allergist how you can prevent symptoms, and they might have you increase your medicines and decrease your outdoor physical activity as well. The air quality index is high. And then finally, working and exercising inside while the air quality index is high is important as well, if possible. That's because physical activity like exercise, it causes you to breathe faster and deeper, and this can pull more polluted air deeply into your lungs. But if you have to spend time outside, then it is best to wear the N95 rated mask. And this is because cloth masks and face coverings, they don't provide enough protection from wildfire air pollution. And when you are wearing the N95 mask, be sure to cover both your mouth and your nose, and also protect your eyes. And then finally, you also want to improve your indoor air quality. So since you'll be spending more time indoors, it's equally as important to make sure that your indoor air quality is good. The polluted air, it can actually enter your home and get trapped there. And we'll discuss steps for improving indoor air quality in just a bit. So essentially, you want to be mindful of air quality and avoid spending a lot of time outdoors when air quality is poor, if possible. And you can visit the National Allergy Bureau at quadai or AAAI.org/NAB for pollen count information. Again, you can also visit airnow.gov for Environmental Protection Agency air quality alerts. And both of these websites, they also have apps that are available for smartphones and tablets. And additionally, local news reports often share pollen count and air quality information as well. And now I will move on to indoor trigger avoidance strategies.
We're going to talk a little bit about environmental triggers, things like dust, pets, and mold that Jessica talked about that can cause asthma and allergy attacks. And then they can be possibly life-threatening. We want to minimize exposure to those triggers and create a healthy environment if you have asthma and allergy. And so having good indoor air quality is a key component of this and essential for creating a healthy living space. So most people in the US spend about 90% of our time indoors, and our indoor air, believe it or not, can be 2 to 5 times more polluted than being outside. So we offer a free asthma-friendly home checklist on the website there at afa.org/healthyhome. It's in English and Spanish, and going through this can help you identify and reduce your indoor triggers. And if you're a renter, you can share this web page
Dr. Pugh. And she got knocked off. Give me 1 second to put her back in. Give me 1 second to get Dr. Pugh.
I don't know what happened.
That's okay.
Let me go back to sharing.
Okay.
It is this screen. You have to enable it for me.
Screen share.
Yes.
Oh, hold on. Let me pull you in. There you are.
Right where it left off.
Landlord
Mhm.
if needed, and we'll talk about some general strategies for improving your indoor air quality with you
Make it
today.
bigger again.
Okay, so how to improve your indoor air quality and reduce triggers in the home. Cutting down sources of allergens and asthma irritants throughout your home is possible. Things like improving airflow in your home, so leaving interior doors open while running exhaust fans in bathrooms and kitchens can be a good strategy. Avoid harmful products. Things like pesticides and bleach and other harsh chemicals can trigger asthma and should be reduced as much as possible. Using those certified asthma and allergy friendly products, things that we know reduce allergens on bedding, using HEPA vacuums, cleaning products, things like that. Have a regular cleaning routine to remove dust, pollen, dander, and mold. Measure your home's humidity level. If you have moisture, try to keep it below 50%. You may need what's called a dehumidifier to reduce that moisture. Keep windows closed during peak pollen times, like Jessica mentioned, and also times of high outdoor pollution. Things like scents. So we love a good scented candle, but unfortunately, we know that things like scented candles or cleaning products can actually trigger asthma. So removing those from your home is recommended, and using things like battery powered ones. Carpets are a huge trigger potentially, so replace those if you can with solid surface flooring. Maintain your HVAC or furnace and air conditioning system, replace those air filters, use a portable air cleaner, air purifier in rooms where you spend the most time. Okay, so depending on where you live, obviously you all are in Ohio, there's going to be Ohio specific housing codes. And so it's ideal to for families not to be exposed to harmful asthma triggers. So by law, landlords are required to abide by state housing codes that protect people's health and people's safety living there. So this is just a quick snippet. You can check out your Ohio code at codes.ohio.gov if you're interested. And then local organizations like Ohio Healthy Homes Network may be a good resource to help. If you are a renter and you know that there are things in your home that are making you sick related to your asthma, here's some just general tips for talking with your landlord. We know that this can be overwhelming process for some, and people are worried about retaliation or losing the housing. So reaching out to a local resource if you feel like that's needed to help with advocacy, that should be available. But one general tip is to first talk about the issue informally with your landlord. A conversation via email, via phone, however that works for you. Um, then you can start. This also kind of helps document your timeline, ideally putting that timeline in writing so you have it. If that doesn't work, you can formally communicate in writing and outline your requests as well. If they ignore your requests, then you can notify your landlord that you may take further action if it's not resolved, and that you may have to, show proof that you tried to resolve it out of court. So definitely seek your local resources. going to talk a little bit very briefly about AFA's resources. So that was a lot of information. Thanks for sticking with us. We are a national organization, but we do offer resources for anyone across the US. We have lots of resources on our free AFA store. We have a support center, which is a toll-free hotline available Monday through Friday, 10 a.m. to 3 p.m. Eastern Standard, except US holidays. We request 2 business days for a response. You can also email us, but if you have a question or need some guidance on how to live with your asthma, we can help with that. We have a couple online communities, which are online support groups that you can join. One is specific to asthma and one is specific to food allergies. We also have a learning catalog for families and patients, healthcare providers. We have some CEU opportunities if you have a credential that you need those opportunities. We have Ask the Allergist, which has some common questions about asthma and allergies that our board certified allergists can answer some general information. But this is definitely not substitute for medical advice from your physician. And then we talked a little bit about our asthma and allergy friendly certification program. You can learn more about that and those products at that website. Lastly, wanted to let you all know AFA has partnered with some program advisors and created the Black Women's Asthma Alliance. And part of that resource is a Facebook group that is specific to this community. It's for caregivers who may be taking care of others with asthma or people that live with asthma themselves. It's a private group. We'd love to have you join us. Just scan that code with your phone camera, or you can get directly to the group by typing in afa.org/join BWAA to get to that group. So love to see you there. Really quickly going to talk to you about some safe cleaning products. The EPA has a nice list of things that you can buy over the counter. Their Safer Choice program, it is a label that can help consumers identify what might be healthier and for your lungs to have in your home. And then feel free to take a quick picture of this. Here's some great safer cleaning recipes with just a few basic ingredients. You can create household cleaners that we recommend, and believe it or not, are very effective and very very economical too. We are obviously not with you all in person, but you can reach us if you have any questions at programs@aafa.org. And I'm going to end the slideshow here. Okay, so it was great to meet everyone. Thanks for your time, and we look forward to seeing you on our online communities or any other space. And again, thanks to the hosts for having us, and we hope you found this beneficial. Take care.
Okay.
Hello, everyone. So I hope that you found the video as informative as we have found that video and the other videos that we have shown, and then some of the things that we have talked about either before or after the videos. I know one of the things that that they didn't mention was, because it is summertime and we're usually in our cars because it's warm and we're running the air conditioning. And so making sure that when you're idling your cars, that you're not idling your cars around groups and motorcycles, which we see a lot of those right now in our communities. The other is the fact that a lot of us are doing some outdoor activities, and one of them is grilling. And so if we are barbecuing, making sure that we are, if we're near the windows of the home, that we're shutting off the windows so that everything that we're barbecuing, the charcoal, the fumes aren't going into the house. And then as soon as we get in the house to take those clothes off in the shower, particularly if we're working with or live with family members who have asthma. We also have Sharonda here with us this evening. So I have promoted you to a panelist, and I've talked about your program, but I want you to tell them about what you all do there, because we are here because you are there to bring us here. So we appreciate you all giving us this opportunity to talk to the community about asthma, and we appreciate our providers in Lorain County coming on so that they can get additional information.
All right, we really are thankful to partner with you. Everything you've done is just a yeoman's work over there to really support the community in this way by getting this information out so that people really can manage their asthma better, right? Like having the triggers is so important to maintaining and having less asthma exacerbations. But we really appreciate the opportunity to partner with you. Thanks for letting me in the room this evening.
Do you want to tell them anything else about your program, about how, if they want to sign up to be a part of it, particularly since we have some providers on?
Oh, absolutely. So our program at the Ohio Department of Health is a few different prongs, but we certainly have a school support prong where we support schools to decrease asthma exacerbations by making sure they have asthma action plans to students. We have lots of resources through that. If you get a hold of Yvonne, I'm sure she can get you to me and we can get you the resource list of things that you can order. I certainly we really applaud the work that you're doing. The programs that we also have a monthly asthma care improvement collaborative meeting. And that meeting is really important because it allows like-minded people to come together and talk about asthma in a way that they can earn CEUs for nursing, social work, and sanitarian. In addition to that, we also have an asthma newsletter, right? One in which we promote through our asthma newsletter. We are able to educate about different topics for asthma. Also reminders for all our different events. If you're a provider in the room, we have a new YouTube series for asthma that your patients could utilize. It really is meant to support at all levels. So it's good for parents to learn about the different processes and phases that the student would go through with asthma, or if you have asthma yourself, it's a great tool to be a reminder full of all the triggers and things that you need to do. We also have funding. So if you sign up for our newsletter, we do send out funding opportunities through that that are directly from the asthma program at the Ohio Department of Health. And I'm Sharonda Whitner, the Specialty Services Supervisor in the Bureau of Child and Family Health. And we certainly, love to partner with people all the time.
Thank you. We appreciate that. So we do have, if any of you need the packets of information, if you're a provider and you need them for your groups, we are willing to make sure that you get them. So we know that some of the groups have gotten booklets, but we have plenty of more for some of our nursing groups, some of our groups that are doing community engagement, our community health workers. So if you give us your information, I know Dr. Hugh is going to put it in the Q&A area. We can make sure that we get that out to you because we sent some stuff out to Lorain County. I actually drove it there last week. Some people asked for some additional information, and we took out about 25 more booklets so that they could have them. So we've been making sure that we get the information out. And before we leave, also a couple of the other things that were not mentioned in the video, they talked a little bit about rodents, but I like to talk about it a little more. I've worked in a hospital setting at one time, and so we would get a lot of families that would come in who were having, who would bring children in who were having asthma attacks. And what they wouldn't tell the doctor is that they had actually tried to get rid of bugs in their home and set off one of the bombs, closed off everything in the house, set off the bombs, and now you're at the hospital because the baby is having some issues. And so they would tell us in social services, but they wouldn't tell the doctors downstairs. So we knew a lot more about the things that were going on than what they knew down on the floor. And so we started talking to the families and saying, look, if you're trying to get rid of bed bugs or any kind of other rodents in your house, to make sure that you either have a plan to leave the house while the house is airing out, to make sure that you're working with a licensed provider exterminator so that they can come in and do the right things that are needed for the house. So hopefully, because some of them have some things that won't exasperate your asthma as some of the other things will, like some of the things that we buy. And when we buy them, we set off a lot because we think a lot helps even more. And we make it worse. And so that was one of the things. The others is around candles. I love candles. And and I know that a lot of people like to burn candles. So if you're burning candles and you have people who have asthma in your home, you might not want to burn candles. Or making sure that you're opening up the windows too. So you're airing out. So you have the candles are burning, but you're airing out. The other is perfume. Many of us love perfume and we wear it so that other people can smell it. We don't just wear it for our enjoyment, we wear it for everybody that comes by. And so it's important for us to remember that if we like and love our perfume, that when we're visiting people who may be in the hospital or may be ill or have some other issues, that we should not be wearing all of our perfume, particularly in our work settings. We used to talk about it at the hospital all the time. There was a rule. If you worked at the hospital, you could not wear perfume if you were working on the floor. And for some reason, I don't know if they actually follow that rule anymore because I've been in many hospital settings where I could literally smell all the perfume coming from the workers that were there. So I know it used to be in the handbook. So I don't know if it's something that has been removed from the handbook or if people just aren't reading the handbook because we had to read it. There were certain things we had to do. The other, if you are working in areas where you are exposed to a lot of dust, making sure that you are wearing a face mask. Using those masks. We have a lot of masks that we did use from COVID, making good use of those masks and making sure that you put them on. And cleaning products. She talked about making some of the other cleaning products up. And I think a lot of us think, oh, it doesn't work. Those don't work as good as going to get the Fabulosos and the Pine Sols and all the other things. But just think back, if you're my age, think back to when you were growing up and what you smelled when you came in the house when people were cleaning. And it was usually vinegar. Because I know at my great grandmother's house, she used a lot of vinegar and water. She used vinegar to wipe off the glass windows and her tables, and to do a lot of the other cleaning. So knowing that those things work very well in cleaning and that you don't have to use all the heavy abrasive things and that sometimes when you mix up other things, it causes other reactions. We had an incident where mixed up, poured some bleach in something, forgot I had poured it in there, and then put some Comet in it, which set off a whole another kind of fume in the house. And luckily I wasn't close enough where it would have just knocked me out. And so making sure that we're doing those things, but also making sure that if we're having any types of people over, that we're being careful about first, second, and third hand smoking, that we're looking at what we're doing outside, that we're looking at what our children are doing when they're outside or if they're in camping areas. We've talked to some of the summer camps about the fact that the nurse has access to the inhalers, but the nurses don't always go on the trail when they go to do summer walks. And so making sure that those inhalers are available for the children to be able to get a hold of. And so those things are important. And we're going to open it up for any questions before we end for the evening. So are there any questions? And I know that Dr. Pugh has your information. She has everyone's information, and so we know that we will be getting back in touch with you. We also have the same version of this on Saturday for people who are available during the day and they're not available for the evening. So we also have a session on Saturday from 11:30 to 12:30. And so please encourage family and friends and loved ones to come and participate. We'll send out some other things to our network to get people involved. And we are live streaming today. So this is on LinkedIn, it is on YouTube, and it is also on Facebook. And so yesterday we had quite a number of people that participated. I see something in the Q&A. Thank you. Thank you, Paris. Thank you all so very much. Dr. Pugh, do you have any final thoughts before we leave?
I do not have everyone's information. Mark Adams, if you can just put your information in the Q&A.
And I know he's with the Lorain County, I think the Lorain Health Department. But we can get it from him. I have his information.
Okay.
Thank you so much, everyone. Sharonda, do you have anything else before we leave for the evening? Thank you all so much. You all have a great evening. We appreciate you being here with us. Thank you. Good night.
Yeah.